20% of the American public has a disability of one form or another that interferes with their ability to perform activities of daily living. If we can't develop a profession pre-tuned to the concept that we have to help our community, then we're a basic failure.
So right now we're standing in the personalized care suite. It was opened up last year.
All the patients we see here in the center have either medical, physical, cognitive, emotional conditions that require modifications of the way we deliver care. And what we're doing is teaching the students that most of those modifications are relatively minor and can be provided in a general practice setting. We have 12 open operatories that are set up as conventional dental chairs, but all of our chairs have the ability to switch from left to right. We have equipment that allows us to treat patients in a wide variety of transportation devices, wheelchairs. We can see patients on medical gurneys. We have X-ray units in every operatory so that we don't need to move the patients around. We can provide all our services.
There are a few special rooms around the perimeter of the personalized care suite. The one that we're in right now is extremely special. The walls are soundproof. There's also a door to the side where there's an entrance that people can come in and wait in this room. A lot of patients have anxiety, so by them coming in here instead of having to wait in the waiting room is a really nice opportunity for them. There's also the ability to play music in this room. Some patients don't want to hear other things that are going on, like drilling or other things like that. There's also yoga mats that you can put on the ground and have the patient sit on the ground with you. There's a lot of different modifications in this room to be able to help patients.
Our chairs all have triple articulating headrests, which means that if we have a patient in a wheelchair who we can't transfer to the chair, we can back the patient up and utilize the headrest to provide head support.
One thing that's really nice is that there's a pathfinder on the ground. So patients who are not able to see can use the cane and walk around with that to be able to find where they need to go.
In our first year open, Penn Dental Medicine's personalized care suite, we're able to see nearly 7,000 patients. And that number is growing every week. Our patients come from as far as 3 or 4 hours away from here. We try to make every visit meaningful.
Great experience. I love the doctors here. I get treated here, you get respect, you get everything.
I even had a Zoom meeting with the team before making a treatment decision. So it was like us, the dental team, and the individual's family, and you wouldn't find that anywhere else, to take the time out to go over the care plan in such a detailed way.
A lot of parents come in, or caregivers, and they talk about how they weren't able to have their child be seen in a different office and how calm their child now seems here.
There is a tremendous need in the public to be able to have dentists that understand and care for them. We need to find the method that permits this person to receive their dental care with dignity and effectively to treat the disease that's in their mouth and prevent new disease.
If dentists don't feel comfortable treating patients, they won't treat patients. By providing this as part of their educational, we're giving them a comfort level and appreciation that they can treat these patients safely in their practices.
I see a lot of the faculty and what they do with these patients and how they talk to them, how they treat them, and how they go about making modifications so that everything suits the individual person best.
I could not be happier with all of the people we partnered with. They were so committed to making this a reality. Dentsply Sirona was exceptionally cooperative in imagining things differently. This is just a great place to teach people how to use every accommodation.
This is an amazing center. Our hope is that someday a center like ours won't be necessary because these patients will be able to access care out in the general community.
I would hope that all the individuals supported could get care like this in all aspects in medical care of their lives. This is just a component, but it shows the need for this kind of work and to continue to support this population that Penn Dental serves.
We have the capability of changing the quality of life for so many people, and I think that stepping up to do it is just part of who we are.